Hi, my name is James Bennett, and this is case study number 15. The patient is a 6-year-old male. His mother brought him into the hospital because his breathing has gotten increasingly worse. She also noticed that his exercise tolerance has decreased over the past week. He's been coughing more, and he's been coughing up dark sputum for 5 days. The patient's appetite has also decreased. He's lost 2.5 pounds. The patient was diagnosed with cystic fibrosis at 8 months old. Since then, he's been hospitalized 3 times with respiratory infections and hemoptysis. The patient was given IV antibiotics and was in the hospital for 2 to 3 weeks for each of these infections. The patient was also diagnosed with bronchiostasis and pancreatic insufficiency. The mother says that she's been giving her son post-sterile drainage for 30 minutes 3 times a day. The physical examination revealed a temperature of 98.4 degrees Fahrenheit, an oxygen saturation of 88% with room air. The patient was immediately put on a ventilator. The patient is 3'4" tall. Normal range, the lower end of a normal range would be 3'6". The patient is 29 pounds. The normal range for weight would be 36 pounds and up. The patient is also experiencing labored breathing. His skin is pale and cool to touch. Both of his nares reveal dried mucus. His lungs crackles can be heard in the upper lobes. Also decreased breathing sounds in the lower lobes and wheezing. The patient is also experiencing tachycardia. The patient's lab results revealed an increased amount of white blood cells and bands and a decreased amount of monocytes, calcium, and hemoglobin. These results, the white blood cells and the bands, indicate that his body is fighting off a bacterial infection. The decreased monocytes would also indicate a bacterial infection. The patient tested positive for the following cultures: Pseudomonas aeruginosa, Stanzotrophonotus matophilia, and Staphylococcus aureus. The patient's pulmonary function was approximately 63% of his predicted value. The patient's chest x-ray indicated a consolidation of the lower lobes, indicating consistent pneumonia of both lungs. Based upon the patient's medical history, physical exam, and laboratory test results, I believe this patient has cystic fibrosis with a secondary pneumonia infection. The course of treatment that I would recommend is IV antibiotics in the hospital to get rid of the bacterial infections. I would also prescribe mucus thinners and start respiratory therapy approximately 3 days or when the patient feels up to it. I would also prescribe bronchodilators to open up his airways so he can possibly breathe better. I would also have the patient on oxygen as needed. I would expect the bacterial infection to be cleared up within 3 to 4 weeks, and a follow-up examination of the patient's lungs to be done to ensure that the patient is not in need of a lung transplant. Thank you and have a great day.